Hi, everybody. Okay, so I want to try and make this a little bit more interactive so I don't put everybody to sleep. It's the end of the day. I know how that goes. You guys are probably tired from doing all the running around, picking up, dropping off activities, and all the other life stuff that we have, right? So this talk is basically going to be about fostering. How many of you are first-time foster parents? How many of you have been foster parents or resource caregivers for at least 5 years? Awesome. How about 10 years? Awesome, right on. You guys could probably teach us a lot. So if you guys have comments, questions, feel free to jump in, interrupt. I'm all good with that, okay? So how many of you felt that you had enough information to feel prepared to be foster parents? Somebody's shaking their head. No, yeah, that's what I get from the therapy work that I do. Is a lot of foster parents come to me and they're like, oh my gosh, what did I get myself into? Like, this is crazy. I thought I was just going to provide shelter and a safe place for these kids, and they're going to love me and they're going to feel safe, and it's going to be exactly right. It's like, oh no, that's not how it goes at all. So this next slide is kind of something I found, and it's basically talking about the truths of these children, okay? Being a parent to someone who has never been traumatized is very different from the kids from hard places. As you guys probably all know that now, right? They've been in your homes for a while, and it's like, what is this behavior? Oh my gosh, what is going on? And the parenting practice you use for your child is not as effective for some of these children, yeah? And because of that, we ourselves, if we haven't come from a traumatic sort of background, we need to kind of learn what that's about and try to understand about the trauma that they've been through in order to provide the kind of care that they need, which is very, very different. And as you know, it's a lot of patience, and sometimes it's very rewarding once you finally find out, like, oh, that's why this kid is doing that. Then you kind of start to connect, and that connection is key. So hopefully, what I'm hoping to do today is to help you folks understand the effects of trauma on a child, recognize manifestations of trauma, because it's different for everybody, huh? When you go through something traumatizing, you're going to react different from someone else that goes through that same trauma, okay? And same thing with these kids. They're very different, and it manifests very differently. Ways to address the trauma, ways to help the children transition into your home. So it's not just providing a safe place, it's also being able to help them recognize that this safe place is gonna be safe for a while, okay? And then ways to maximize therapy, how to work with a therapist, what to bring, how to address the concerns so that you get the most effective treatment for your child and for your family. Okay, so this quote is from Stephen Porges. I hope I'm pronouncing his name right. He's a university scientist and professor of psychiatry at University of North Carolina on Chapel Hill in North Carolina. And he studies psychology, neuroscience, and evolutionary biology. So this quote really speaks to me because, again, it's a matter of connections, okay? When we're raised in a home where there's safety, there's trust, the connection happens naturally. And for these kiddos, they don't have that connection. And because of that, trying to learn to connect with another individual is challenging. It's like telling them, okay, you're gonna forget everything you've ever learned, everything you've ever raised from babyhood all the way to where you are now, you're gonna forget that. And that's not gonna work for them because they know what works for them and they've survived the trauma that they came from, okay? So how do you reach these kids? Well, that's hopefully something we can kind of look into, okay? So parenting, again, a child with trauma is very different from parenting a child without trauma. Okay, who knows what this is? Legos, all right, you guys are on it today. So we're gonna do an activity. Yay, did the best you could with what you had, huh? Yeah. So what do these Legos represent? Because you know they represent something, right? I'm not just going to have you guys play with Legos. So they represent your kids. Okay. What they come in with. Some is just naturally, they're naturally born with skills, right? And genes. Some were taught how to put two things together, use what they have. Some have the verbal abilities to communicate. And some have the confidence, they have the milestones that they, maybe the abuse happened later on. So they have the foundation. So you had yours already set. So what this represents is maybe a teenager who already had the skills. Mom and dad were doing great. My boys put this together, by the way. And he was very nice. My 8-year-old told me, yes, Mommy, you can borrow my Legos, so please return it. Yeah. It would have been fine. He told me which ones was okay for me to play with. Yeah. So this is what he shared. Yeah, I know. And this isn't his best one. He has one where it's like mechanics and you can kind of, the little robot thing. He didn't trust me with it. So he told me I could use this one. But what that represents is your kids come in with different skills, different levels of what they can and cannot do. Okay, if they don't have the foundation, they try their best, right? No matter what age. If the abuse happened at a young age, they're going to try their best with what they have. So as we do our talk, just kind of remember that piece, okay? And it does take a lot of patience, a lot of understanding, a lot of looking beyond what's in front of you to fully understand these children. Can you make a difference? Yeah, you can, okay? It won't be easy, but the connections need to be made first, yeah? Creativity can flourish in a safe environment, building can occur, but you also have to remember it's the stunted growth. They're at different developmental levels, and they need to have that sense of connection in order to start building on what they have. Okay. So you know that trauma affects the building process, the growth is stunted, and some kids, though, may have some parentified behaviors. They are usually the oldest child of the sibling set. Yeah? The oldest child of the sibling set that was made responsible to care for the younger siblings because mom and dad couldn't. Okay? I worked with a 5-year-old at one point, and she had to take care of her 2-year-old sister. Mom and dad were out on drugs, using drugs, not preparing anything for them. So she learned how to find a banana, cut it up, feed it to her sister, and that's how they survived. When they came into therapy, this little girl, she's very mature, and she's very smart, but she was also very resentful. So something as easy as playing with a doll, we played dolls in my office, and she just expressed that resentment. We're going to put the dolly to sleep now. Let's read him a story. Why do I need to read her a story? Nobody ever read me a story. Yeah. And so it's like, okay. So things you expect a child to like, oh, this is going to be fun playing with dolls, they get triggered. And that brings back bad memories. Why did I have to do that? Why was I placed with that responsibility? So you can imagine this 5-year-old growing up into teenage years, carrying that resentment. Okay, so those are things to kind of, again, think about. And so when that little kid is tantruming because they're playing nicely, something can trigger them. And that's where you see these behaviors start popping up. Yes? Absolutely.
We think so because we have someone that's 8 years old. I mean, 3rd grade is still going to the bathroom, so
Yep.
they have to wear pampering. So
Yep.
they don't wear anything. It's a given.
Yep.
It's a given.
Yep. So a lot of these kids, depending on what kind of abuse they've been through, they will regress. It's called regressive behavior. Regressive behavior is basically more child-infant-like behaviors. Okay? So pooping, peeing, that happens. A lot of the times I hear from resource caregivers, they're doing this just to make me angry. No, yeah, they're not. They really can't help themselves. It's associated with anxiety at times. When changes happen, maybe all of a sudden, they're out of their pull-ups. They're doing great. And then they have a visit. Then they wet the bed. So those things happen. It's a manifestation of what's going on inside. Okay?
Does it ever get better?
It does, and again, that's like when you provide the stability. I'm sorry, I'm supposed to repeat the questions, yeah. Does it ever get better? Yes. That's again, some of the trauma. Maybe something in her classroom is bringing it up, and it's scary for her. So with that situation, sometimes talking to them, providing that reassurance about coming back. With one of the kiddos I worked with, we had what was called a transition object. So that was like a special something that we give them, like, okay, for my kiddos, they had a hard time initially going to school. We gave them like a little bear, and we said, okay, depending on what kind of trauma they've been through, that's hard sometimes for them. So providing the constant reassurance, yeah. For some kids, like writing letters back and forth to their parents might help. So if she, starts feeling that way and she wants to draw a picture about how she feels, again, it's processing some of that sense of fear. No, with you. I'm sorry, with you. If she wants to write like a letter to you saying, Mommy, I miss you or whatnot, and she, or you can draw a picture for her. What also helps is just letting her know, like, I will come back at the end of the day. Setting up a routine. So try to make it as same as you can every single day, so it's a little bit predictable. The challenge with kids who have been in, I went forward, I'm pushing all kinds of stuff. The challenge with these kids is that there's an unpredictability. They don't know what's going to happen next, yeah? They was in an environment where there was just chaos. It was unpredictable. I don't know if my caregiver is going to come back because they didn't the last time. So it's scary, yeah? So you're going to have to try and reprogram that, and sometimes it does take time and a lot of patience. Trying to make things as predictable as possible can help. If there's going to be a change in routine, gotta let them know. Keep communicating with her, keep reassuring her, and letting her know that, even though a lot of these kids, they worry, they push the boundaries because they think eventually they're going to give up on me. My biological parents gave up on me. They never got clean. They never did what they needed to do. They gave up on me. And they think you're going to do that to them as well. Okay, and that is the scariest thing for these kids, right? Imagine, you're being so little and you're depending on somebody, and that person who brought you into this world that's supposed to love you more than anything doesn't do that for you. How horrifying is that, right? So trying to break through that and reassure them that I'm going to be here for you no matter what. That's key. And if you can get to a kid and make that connection, you got it for a little while. For a little while. Exactly. They'll keep testing it. Yeah, it's frustrating. It is. It really is frustrating. And that's going to be something that is probably going to be one of the most challenging things, is that they're going to doubt you. And you cannot blame them for that because that's what they know. Yeah. They've been abandoned. They've been neglected. They've been hurt. And now they're supposed to trust you? Like, really? I have teenagers that kind of walk in my office like, yeah, why should I trust you? They have no reason to. And being open about that, yeah, you're right, you have no reason to trust me, but I'm here anyway. All right, so these kids come with backpacks, and unfortunately with our kids, sometimes it's a trash bag of just their belongings. And when you see that, that's what they carry with them, their memories, their trauma, the abuse. Okay? Any military families? All right. So they're like these little military children. They're soldiers. They've learned how to protect themselves for years sometimes, and it's worked for them. They've survived through some really tough, ugly things that some of us can never fathom. And so they're ready for war at any time. So when you try to strip that protective layer off, It's scary. It's terrifying. It's like saying, you know what? Let me take all of this off of you, and now you go to war. That's not going to happen. So, it's always about protecting themselves. What do you ask of them? You got to think about what are you taking from them as well. Okay? All right, new territory. How many of you ever been to a new school? One? New school, like growing up, just growing up. Any new schools that you guys ever like had to go through? Kind of scary, yeah? You start thinking about like, what's that going to be like? What's my teacher like? Am I going to make friends? How big is this school? You know, all kinds of stuff, right? So imagine all these kids being dropped off at your house. What's that like? I gotta sleep here? What? I gotta call this lady my mom or my auntie? I don't even know her. She looks different from me. They dress weird. They eat weird stuff. I'm supposed to live here? Seriously? For them, sometimes it's like Mars, right? Completely different. So trying to find some of the similarities is important. Well, what kind of food did you eat at home? Maybe it's something you can provide, you know? Oh, you guys wear tank tops? You guys wear shoes in the house or not? You know, simple stuff like that can mean the world for someone that's just coming into the home. I know some foster parents is like, well, we go over the rules right away. Okay, rules can be good, but they can also put someone off, yeah? Again, you're trying to build that trust. Basic rule safety, that's fine. Everything else, one important thing, especially with teenagers, I always tell parents, pick your battles. What really is important? They don't pick off their clothes off the ground. You know what, that's okay, right? Is it really worth fighting about pants on the ground? Maybe not, okay? So those are some things to kind of think about. All right. Okay, so always remember that even the smallest things can trigger them. I've had families who tell me about, oh yeah, you know, we went camping and, you know, little Johnny was so excited about camping. And then they get to the camping site and, it's craziness, and little Johnny's like, I want to just go home. So even positive things can trigger them. Unfamiliar places, overstimulation, unpredictability, changes in routine, those can all trigger your child. Okay. So who heard of fight, flight, freeze before? Awesome, okay. So fight, flight, freeze is, super small, sorry guys. So this is a natural kind of instinct that animals have when they face a threat. Okay, you might see it with like you guys' dog or an animal where there's a threat. They will either freeze in place, like, oh my gosh, I don't know what to do, or they'll fight, they'll growl, or they'll run away. Okay, humans are the same way. If you notice, if you're faced with a threat, you'll react in one of these ways. All right, and so the body naturally has these defense mechanisms, and that's what you see with the kiddos. So learning to unlearn what they've already adapted to is what you're tasked with. So things that they have learned to protect themselves, the triggers, which can be smells, sights, places, actions, feelings, they have to kind of reprogram what they already know, okay? And again, that only happens in a safe environment. They are always processing. Kids who come from very hard places are always looking around for threats. What's going to hurt me? They can seem like they're just playing, sitting, but they're always trying to look around. Somebody going to hurt me? Am I safe? They're hypervigilant. That's part of PTSD. You guys heard about PTSD? Post-traumatic stress disorder, yeah? So they get triggered. They may not understand that they're doing it. So those are some things to kind of slow things down, kind of talk to them about, Okay, what's going on? You reacted a certain way. What happened for you at that moment? And you know what? Sometimes they don't know. And that's okay. Then you take the next step. Okay, well, you're feeling this way. What can we do? So kind of, again, if you're looking at the trauma, trying to calm themselves down. And that's what you're going to try to work with them on.
I got a question.
Yeah.
So if the child is hypervigilant
Yes.
because they've been traumatized before, is there a tendency to try to create trauma again? 'Cause that's
Good question. Yes. Yes, yes, yes. So again, it's the testing the boundaries, right? But, and I've heard adults say this in my office during evaluations, they say they look for chaos. It's something familiar. That's what they know. So this safety deal, it feels weird. I've never been safe. You know, they've been in a chaotic environment. They're used to that adrenaline rush. They're used to being in chaos. It's familiar. Yeah. And so they do. They look for it sometimes. And they try to create it. Yeah.
But that makes me feel better about, instead of being boring and safe, now I know that they're just kind of testing
Yeah.
me and
Yes.
looking, because they're just not used to
Yes.
being so calm.
Yes.
Quiet.
Yes. Exactly.
Pretty
Exactly.
much what they did at home when they was with their parents, that craziness.
Yep. Yep.
That was just acceptable because it's like,
Yep.
"Look at that ball. What do you want?
Exactly.
Outside.
Yep.
Okay."
How come nobody yelling at me? My mom and dad, they said they love me. They used to always yell at me. How come you're not yelling at me? Yell at me. You know, come on, yell at me. Yeah. Exactly.
That's all they want.
Exactly. It's familiar. And so they go back to that, right? You always go back to what's familiar. You guys got bad habits? You guys all got bad habits, right? And you guys keep doing it. Why? It's a habit. It feels familiar, right? That's why vices are hard to kind of get out of sometimes. Because it feels safe, it feels comforting in a sense. It's familiar. And so switching that up, finding new ways for them to be comfortable, new habits, yeah, new ways of feeling loved. That's kind of what you need to introduce. And it's not easy, again, because they're still looking for it, yeah. That's why a lot of these kids, they tend to go towards drugs, towards adrenaline kind of kicks. They do risky behaviors because it's familiar. Kind of feels good. You do get an adrenaline rush, right? It kind of feels good. You got to teach them other ways to kind of channel that. Good questions. Awesome. I'm going to go a little bit faster. Overstimulation, we talked about being triggering as well, something fun. Too many people around, sometimes they do need their quiet, so that's something to look at. Trust, we talked about. Another key thing with these kiddos from hard places, the more moves they've had, the harder it is to be trusting towards others. Okay. The more moves that a child has had, yeah, more placements that they've had, the harder it is to gain their trust. Yeah. Okay. And big hurts. So how many of you kind of have an idea of your child's history? The thing is, the bigger the abuse that happened, the longer it happened, the bigger behaviors you're going to get. Okay? So again, list of people they trust, right? You want to make that list. And it's hard to make that list. So, all right, back on the road. All right, here we go. So effects of trauma, which we already kind of talked about. I'm sorry, it's really small, but I'll read it out to you. So there's physical effects of trauma, and sometimes that can be poor gross motor skills. So the fine motor skills, maybe they don't have the opportunity to kind of strengthen those skills. I had how old was he? 3-year-old who was never introduced to crayons come into my office, and it was the coolest thing for him to see crayons and to actually color for the first time. He colored a picture of his family, and it wasn't pretty, but still he did it, and so that was pretty awesome. So expecting some of these kids to do things that you think they'd be able to do, they may not be able to. You'd have to kind of train them, strengthen those skills, yeah? Emotional, a lot of the times I hear that some of these kids don't seem remorseful. Yeah, they don't have the empathy. They don't know how to connect. That's how they were raised, yeah. There were no consequences. They didn't connect with another individual, so it's hard for them to empathize. So that's that basic thing you're gonna have to teach them. How do you teach them? Well, same thing how you teach like a 2-year-old or a 3-year-old. You watch a show and say, oh, I wonder how that person's feeling right now. They lost their cat. What do you think they're feeling? And kind of trying to engage them in that conversation so that they start learning, oh, okay, that's what happens. Happens to them, they might feel emotions, but they experience emotions very differently. And that brings us to the next thing where there's emotional dysregulation and something that's called numbing. You guys heard that before? Okay. So the numbing is when you become so traumatized, you tune out. You don't feel anything. You sit there. There's chaos going on. Mom and dad are fighting. Things are getting thrown. Mom is getting beat up. They're just sitting there. And it's going back to that fight, flight, freeze kind of reaction, yeah? If I stay completely still, they won't hurt me. They almost want to disappear. They don't experience the emotion, okay? They become desensitized. Sometimes the adrenaline is just going all the time, that after a while it's like, oh, yeah, maybe they're a teenager now and mom and dad are still fighting. Always happens. Oh yeah, they're throwing blows again. Oh, they're fighting again. Oh, police coming again. That's just how it is. Yep. What else is new? Exactly. So then when they become adults and they're in their own relationship, boyfriend beating up on them, happen all the time. It wasn't as bad as mom and dad, so I guess this guy really loves me. Because it's not that bad. Doesn't hurt me that much, yeah? It becomes their reality. And so you kind of need to address that sometimes in order for them to have the right frame and the right context of what they're seeing. Behavioral, poor boundaries. You'll see these kids get into personal spaces because they were never taught being too close to someone kind of is not right. Some kiddos who have been sexually abused will sometimes have these boundary issues as well. I've seen little girls, go up to strangers and like, oh, let's go home, and just that little flirtatious, and it's kind of cute, right? It's a little girl. It's like, oh, she's so cute. She wants to sit in, this man's lap or sit in my lap. But that's because they've been taught to do that. And then it progresses to something else. And so really teaching them safety bubbles is important. You guys heard about safety bubbles before? Yeah. So teaching them even standing next to them and saying, okay, does this feel comfortable to you? Does this feel comfortable for you? And then letting them practice on other siblings, okay, what's other people's comfort zones? Because it's different. And again, you're going back to that whole empathy, and what feels right for them might feel different for someone else. Okay? They get into a lot of trouble. And again, it's because of the trauma they're experiencing. Yeah? In school, there's a lot of structure, so some of them will actually do a little bit better because of the structure. Some of them will just be like, this structure is just too much. I can't deal with it. And you have another adult telling me what to do, and I can't do it because I never learned my ABCs. I never learned the basics. What is this math stuff? That's not important. I don't know what I'm going to eat for dinner. Am I going to eat for dinner? That kind of stuff. So for them, education might not be important at all. Okay. And speaking of education, so you'll have these delays. So it's really important if you see a certain delay in your child to get them the extra help, whether it's tutoring, after school help, address that because it starts to affect their self-confidence. The sooner you catch it, the better. Kids who don't know how to socialize. They know aggression pretty well. They know how to protect themselves. They know how to tell you no and what not to do, right? But they don't know how to connect. So you guys are the role models for that. They may not do it right away, but if you're doing it with your spouse, your partner, You're doing it with your biological kids. You're doing it with someone else in the community. They're watching. They're watching how you connect, because all they know is what they saw. And that wasn't really connection. If there was DV, domestic violence that was going on, drug use, they didn't see any of the connection. Okay. Okay, so brain development. So not only, physical development, cognitive, brain development has been shown to also be impacted, yeah? So this brain here, you see how it's not lit up? This side is all lit up. This is how it should look, yeah? This empty parts are the temporal lobes, which are like right here. And that's like communication. This is of a child from a Romanian orphanage. So the emotional needs of this child were neglected. I don't know if you guys heard of like the Romanian orphanages where there's like very little contact, very little socialization. So there's physiological changes that happen within the brain when trauma occurs, okay? So again, realizing that they're not going to learn at the same speed as others. So you're talking about the multiplication, right? So not only did they not learn that basic thing, it might be harder for them to pick it up. It might be a little bit slower in processing it because of this stuff. Very different. Okay. All right, so we have some physical. How many of you guys had these kids come in and they seem healthy and then all of a sudden, boom, they get sick and they're like constantly sick now? Yeah. So I hear from foster parents that happens. And that's usually because once the adrenaline kind of drops, the body kind of acclimates and is stable, then they get sick. So it's kind of an interesting phenomenon that happens. You'll see scars sometimes, and sometimes those scars can be triggering for them. Sometimes you have to talk to them about, well, yeah, you got hurt. Sometimes they'll talk to you. And the awesome thing is if they start talking to you about the abuse, you know you've made a connection. They trust you enough to share that scary thing. A lot of kids don't want to talk about it. They just shut down or they'll act it out. So if they confide even a little bit in you, you're on the right path, okay? Right. Stress, being under a lot of stress, we all know from whatever jobs we do, I'm sure you guys have all gone through stress before, even just taking care of the kids. It impacts the body, yeah, in very different ways. And that's why the immune system like sometimes gets all wonky, and their gut, muscles, joints, skin. Moving on to emotional, you'll see a lot of depression. For young kids, depression looks like irritability. They get irritated all the time. They're cranky. That's the depression. Sometimes they isolate themselves as much as possible, especially for teenagers. Having meals together is important. It gives you a reason to get them out of their rooms, okay? A lot of these kids will isolate themselves and they just start thinking and thinking and thinking about the abuse. And so one way around that is providing opportunities where you guys can kind of come together and maybe have some dialogue. Even though it feels like pulling teeth sometimes to get a teenager to talk, that's one way to do it, okay? Anxiety, fearfulness, you talked about like the drop-offs, yeah? The clinging behavior, separation anxiety. One thing you don't want to do with these kids is sneak off. Even with kids who haven't been traumatized, I always tell parents, don't sneak away. You know, a lot of parents are like, oh, I'm just gonna, as soon as they're playing, I'm gonna sneak away. That re-traumatizes them because they don't know if you're gonna come back. So all of these behaviors are manifestations of trauma, okay? And no matter what the behavior is, a lot of it is just keeping you at arm's length. I don't want people close to me. Why? People get close to me, I get hurt. Last time I was close to mom and dad, I got hurt. So you stay away from me, everybody stays away from me. So we talked about cognitive issues and interpersonal. Just talking about what you're talking about, right? Honeymoon over, you're not seeing those behaviors. It's usually the opposite. In the beginning, it's great, right? It's like, oh, it's what are they talking about? There's no problems with this child. And then after 3 months or so, you'll see all of the behaviors pop up. Somatic symptoms are basically tummy aches. Sometimes instead of the emotional stuff, you'll see the somatic symptoms. I got a headache, my stomach hurts. And that's, again, like just the anxiety sometimes becomes manifested that way. The depression becomes manifested that way. Okay. ADHD in these kiddos are sometimes misdiagnosed. Okay. It looks like ADHD because they're dysregulated. They have difficulty concentrating because they're thinking about the trauma. Yeah. They're hyper because they've never been in a structured environment. And so it very much looks like ADHD. But once they're placed in a structured environment, they have some stability. They've been in that stability and that safety for a while. ADHD symptoms disappear. Yeah. So that's always important to kind of look at. Autistic behaviors, same way. I had a kiddo on a case where big DV that was going on, severe domestic violence, almost daily. And the kiddo was 3 years old, I believe. 2.5, maybe 3. And would just sit there. They're freezing. Everybody thought this child was autistic. Never talked, never made eye contact, just sat there. Kid got placed in a home, made eye contact, started talking, started engaging with the resource caregiver. Visits happened. During the visits, frozen, no eye contact, sat there. Is it autism or is it a product of the trauma? It's really important to take notice of these little things. You guys have the eyes, the ears for these kiddos. And you guys are advocates. So when something doesn't feel right, definitely say something. Parents might be seeing something different. Social worker may be seeing something different. You folks see something different. And that's when working as a team is really important, yeah? Okay. They're always a work in progress. We talked about sometimes things can kind of start to smooth over and then boom, they're triggered and you're back to square one. We thought we were done with that behavior. They get triggered. They regress. They go back to what's familiar. Okay? Telling them no. They've never had consistency. So when you say, no, you can't do that. No, you can't do that. I told you you can't do that. They test the limits. They've never had consequences put in place. And so it's sometimes hard to make a change. Okay? Being back to basics, you got to teach them the basic things. I've had teenagers who've come into care, don't know how to bathe. They don't know how to wash themselves. They don't know basic things like changing a pad, taking care of themselves, combing their hair. Those are some things that they were never taught because of the neglect. Okay. They will self-sabotage. You mentioned, sometimes they create the chaos because that's what's familiar. So you need to kind of be very patient and teach them other ways of engaging with other people. How do you do that? Create a safe place. Set some boundaries, being firm, also consistent. You always got to be consistent. If you tell them that you're going to do something, you're building that trust, you got to do what you say you're going to do. If you don't know, let them know. If plans change, let them know in advance. Hey, I know we always go straight home after school. What's going to be different today? Just letting you know, giving you a heads up. That way they know what's coming. It's predictable. It feels safer. Okay? Get ahead of the behavior. Basic needs need to be met. If you know they're going to be hungry, have a snack ready. Always have snacks ready. Why? Because they starved before. And that's a trigger. If they're hungry, they're feeling the hunger pains, they're going to react. Oh no, I was hungry before. I don't know when I'm going to get food. So try to get ahead of that. Prevent the tantrum before it happens. Again, set up routines. Sleep, huge. Huge with sleep. If they didn't get enough rest, they're going to act out the next day. That happens with regular children who haven't been traumatized, right? Yeah? So make sure they get enough sleep. I know video games is a big deal. Some kids get dysregulated from video games. It's hard to pull them off of the video game once they're kind of engaged in it. So you got to know your child. For some kids, you're going to have to give them warnings. Okay, you got 10 more minutes. You better pass this level. I was a gamer, I admit. I loved playing video games, and we used to play all the time before kids. So I know that if I needed to get off of the game, somebody had to tell me, okay, we're gonna go somewhere pretty soon, so you need to get off, giving you 20 minutes. Set a timer, something they can see. Again, it's that predictability, huh? Know their triggers, know your triggers. Let's see what else. Be a role model. If you know you're feeling anxious, you can role model. I'm feeling a little anxious right now. I'm gonna stop, I'm gonna take my deep breaths, okay? Need some quiet space. They see that, and they're gonna hopefully copy some of those behaviors. If you're dysregulated, they're gonna copy that too, okay? So you mentioned, if you're anxious, they're gonna see that, and they're gonna get anxious themselves.
Can we go back to the aggressive behaviors?
Yeah.
When they're calm.
Okay, so aggressive behaviors, did you have a specific question? Like, what do you mean?
Just, I think we kind of skipped over that one.
Oh, okay. So the aggressive behaviors, you have to deal with them when they're calm. If you know your child has a tendency to be aggressive and they're old enough, when they're calm, sit with them and say, hey, so I noticed yesterday, you kind of got upset. What happened? Talk about it. What can we do next time? What are some good ideas? What do you think we can do if we start feeling upset? Teach them how to recognize their own anger that's coming up. What does that feel like? Oh, well, my fists get tight like this, and I feel like I just want to, and I want to scream. Get to the point where they're not exploding yet. You want them to recognize when they're starting to escalate, that beginning part. The sooner they catch themselves feeling angry, the better they're able to control it. If they're already exploding, it's too late. At that point, it's like, okay, just make sure they're safe. But if you can catch it sooner, the better. And set a plan. Yes? Okay. So if you see them starting to escalate, then you can say, okay, I see you're doing whatever behavior, okay, whether it's like stomping, like, okay, let's come to the side, separate them from whatever's making them upset, first of all. Let's take some deep breaths, or let's go for a walk, or let's go jogging, something to kind of get that energy out, depending on what the child needs. So you'll have to kind of see what works for the child. Some kids are okay with like, you know what, I need to go to my room and just calm down. So my younger one is actually good at that. He still does it. I need to go to my room to calm down because brother's pissing me off. Okay. Some kids will need you to rub their back. Some kids may need a drink of water, something that'll disconnect them from what's going on. Some kids need to just talk about it. That guy made me upset. He took my toy and blah, 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 blah. Validate, oh, I see you're upset. Okay, well, maybe we can ask if you can use it after he's done. So help them problem solve, yeah? Okay. Know that reprimands, scoldings can lead to meltdowns. No kid likes being corrected, yeah? We don't like being corrected. So try to catch the good stuff. Oh, I liked how you shared today. Always find something positive to say about them. It's amazing what a difference that makes, because a lot of these kids don't hear the positive stuff. I had a teenager and I told him, you did great on that test. We had some testing that was done, cognitive testing. I told him that, and he was like, what? And he just looked at me like nobody has ever told him that before, and he was actually pretty smart. So it's amazing how they take those kind of things, yeah? Okay, again, we already talked about teaching. They can't get it, it's not being defiant. A lot of these kids want to please, yeah? They want to connect. It's a natural human instinct to want to connect to somebody. They just are afraid sometimes, or they can't. So you gotta find what the obstacle is. Don't fall for power struggles. It's another big one. They wanna be in control. Let them be in control of certain things. Okay, get dressed. I don't wanna get dressed. Okay, what do you wanna wear? Do you wanna wear shorts today, or do you wanna wear your skirt today? They now have some control. They can make a choice. Oh, I guess I'll wear that. Then they get dressed. You want me to help you, or do you think you can do it on your own? Oh, I can do it on my own. Give them the control, right? Okay. Again, teach decision making. The sooner you can do that for these kiddos, the better. Always teach them how to make choices, even if it's just simple choices, because they need to be able to feel empowered. Okay, so this goes back to the whole, give them the choice, be ready for the consequences, right? You let them stay up, be prepared. The next morning, you know what's going to happen. Self-care, even if it's just being in the bathroom for 5 minutes, I'm going to soak in, have a shower on my own, give yourself that. Yeah. Okay, increasing compliance. So this is something I always hear from parents is, they don't listen. Okay, well tell me, what are you telling them? Well, I told them to go upstairs, brush their teeth, put on their pajamas, and go to bed. Yes, too many things. These kids can process that sometimes. Give them one thing at a time, clear and simple. Okay, go brush your teeth. They done with that? Okay, let's go put on our pajamas. They done with that? Okay, well, go pick a book to read. Sometimes you got to keep it really simple. Okay? Make eye contact, especially if they're watching TV. You tell them, okay, go wash up. Okay. They're not going to know what you say. They're just saying okay because they heard some chatter in the background, right? So make the eye contact. Get in front of them, look them in the eye. Okay, we're going to do this, and make sure they hear you. Reduce the distractions. You want to say something important? Turn off the TV. Turn off the video game. Make sure they're listening. And then have them repeat the direction. Okay, what you're going to do? Oh, I'm going to go upstairs and brush teeth. Okay, right on. Okay, set up reminders if you need to. Okay, you're going to be powering 10 minutes. I'm going to set the timer. And then the timer goes off. Oh, remember, you're supposed to go up and brush your teeth. And again, we already talked about picking your battles. And if they're non-compliant, rather than just scolding them, find out what happened. Oh, you didn't go upstairs to brush your teeth. How come? Oh, well, I was distracted. Okay, well, maybe next time we need to turn off the TV and then you can go. Yeah? When to seek help. So the serious stuff, that's when they're hurting somebody, hurting themselves. And when I say seek help, this is professional help. When to see a therapist, yeah? If you see serious developmental delays, so like for your multiplication, if just not getting it no matter what you've been doing, maybe you got to get a tutor, yeah? If they're hurting themselves, that's a big red flag. If they're even talking about suicidal ideation, somebody mentioned, oh, they wanted to kill themselves, big red flag, okay? If there's ever a sense of safety that's being dangerous to themselves or others, that's a big red flag. Okay, working with your therapist, you want to find a trauma-informed therapist. Okay, someone who is experienced in working with trauma. That's really important. And make sure they've worked with children, because there's some therapists who have trauma experience but never worked with children. Children are very different. Sometimes you got to read in between the lines. It's not like working with the adults. They tell you straight up, yeah? You can ask what treatment approach they use. Do they use play therapy? Do they use cognitive behavioral therapy? What is that? Can you explain to me? How are you going to work with my child? And then have a list of the concerning behaviors. So your first session, this is what I'm seeing. You know, how can we work on this? And then ask how you and your family members can help. What can I do? Can I be, part of the therapeutic process? A good therapist will be like, yes, that's what I think any therapist wants. I loved when parents got involved. Okay? Get the school involved. If you're seeing the behaviors at school as well, the therapist should be able to contact the school, help them with the IEP plan. Keep lines of communication open. Always asking the therapist, like, how are things going? Check in. Rapport between your child and their therapist is important. If your child is not connecting with the therapist, it's not going to work. Okay, very important. And be open to change. Sometimes you got to change. Therapists will be like, you got to give up that battle. What? No, you fix a kid. Doesn't always work that way. Okay, So here's some advice from other resource caregivers that I've collected. It's super small, I know, on that. So if you go on my website, I'll put this up and I'll make the list because it's actually pretty good. And of course, you guys are all awesome. You guys are doing hard work. Take care of yourselves. Get respite, connect with other families, and support each other because it's not easy. There's vicarious trauma that happens. Okay?
What is your website?
All right, so you guys have been awesome. If there's any other questions or whatnot, I'd be happy to answer. Thank you for talking to me and engaging. Very much appreciate it.
Thank you.
You guys are welcome.